from steam power which sparked the Industrial Revolution, to the electric telegraph that connected nations.
History is marked by discoveries that have transformed our world.
Each has demanded a leap into the unknown. Those who embraced change thrived, while others were left behind. And now, it's the dawn of a new era.
But this time we stand on the precipice of a far, far deeper transformation.
Join us on this journey to discover how AI will redefine our world.
Will you take the leap?
Perhaps you are the kind of person who doesn't mind going to see a doctor, or isn't terrified of visiting a hospital. Many of us don't. I think it's pretty clear why it evokes such strong emotions. But maybe we could imagine a future where we could save ourselves this discomfort, where these visits were kept to a bare minimum. Artificial intelligence is rapidly becoming a part of our daily lives. One of the areas where it's making significant strides is in the field of medicine. To guide us through the fascinating world of AI, I present to you the physicist, the founder of the foundation Science, I Like It, and our host, Tomasz Różek.
Diagnosis, new drugs, or surgery? Where will AI have the greatest impact? How it will do it?
Oh, it will analyze data about us. So, for example, there will be plenty of data that will be collecting about every patient. So, for example, we can collect the data from our wearables, from our smartwatches, from our smart devices, and then these devices will put this data into AI algorithm, and AI algorithm will know if there is some kind of problem occurring when it comes to our health. When it comes to diabetes, it is actually possible to have some kind of a sticker on your body that will tell us what is your blood glucose level.
Ever thought about how fast a computer could go through thousands of medical tests, spotting even the tiniest signs of a disease? The answer is very quickly and very accurately. Artificial intelligence is a game changer for medicine. We will be joined by one of Poland's most respected AI experts, Aleksandra Przegalinska.
The example that I think could speak to everyone is actually how various AI systems have been implemented to diagnose infectious diseases such as Ebola or COVID. In fact, there is a system called Blue Dot from Canada that has done an incredible job at a very early detection of COVID in Wuhan. And I think it only shows you that an AI model today can really make very early predictions about a possible spread of a very problematic disease. To be honest, I think there is still a lot of fear concerning artificial intelligence and perhaps delegating too much power to it. Many medical professionals are afraid of the mistakes that AI could make if it's not properly supervised, and many of them do not have the training to really work with this technology quite yet. We are at the very early phase of it, so that presents itself as the major challenge for me.
Aleksandra Przegalinska has provided us with her avatar so that our participants can speak directly to an AI.
Greetings, human. I am Aleksandra Przegalinska's avatar. And what's your name?
Hey, I'm Lenka.
My name is Paul Gumkowski.
My name is Adrianna.
What's your profession?
I work as a doctor in general oncological and bariatric surgery in a clinical hospital in Warsaw.
I am a doctor. I graduated Medical University of Warsaw last year, and this month I will finish my internship.
What is life like for a hypochondriac?
Well, honestly, it's like I'm feeling some symptoms. I don't feel well most of the time, but I'm dealing with it. I have to.
AI will have the greatest impact in medicine on predictive analysis. So AI algorithms will help us to analyze healthy patient and tells us which patient can suffer from specific illness.
In the
And
future?
In the future. And then we'll have an option to implement some healthy conditions for this patient so he or she can actually be healthy and not suffer from this disease. And then we can truly discuss about healthcare, not sick care.
Because of the fact that data, medical data is extremely sensitive, but also contained in silo of a given hospital or medical unit, very often that data does not speak to each other, and we would need huge data sets to actually make such predictions work. So that presents itself as a big obstacle forward.
Many people worry about the privacy implications of implantable medical devices. How do you feel about the idea of having a constant stream of health data being collected and stored? Would you agree to implant a chip into your body if it were able to diagnose diseases long before any doctor?
I don't think it's a bad idea. I think it's something that could help humanity. But obviously there are some concerns. I am worried about some stuff about it, the data storage and everything that you're talking about. It's kind of risky to share everything with algorithm.
And who should train it?
AI algorithm is trained on the data by producer of AI algorithm. So producer has to have access to this data to train this algorithm. So it depends. It may be medical university, it may be a medical doctor, but it may be just a technological company that is working on AI algorithms.
How can I cooperate with AI to improve the quality of my job?
In the past, doctors had to spend countless hours analyzing medical images to reach a diagnosis. Today, artificial intelligence can examine thousands of such images in just a few minutes. This is particularly useful in diagnosing cancers, neurodegenerative diseases, and heart diseases.
Image detection by AI models has increased incredibly over the course of the past 10 years. We now have systems that are extremely accurate to the extent of being at 99% of accuracy. So what they see is really there.
For example, one group of data is data from healthy patients, and one group of data is from sick patients. Then AI algorithm and machine learning techniques can actually check what is the difference between this data and can in the future tell if the new, for example, medical image is an image of a healthy patient or sick patient. And for example, when it comes to use cases, we can talk about this one particular AI algorithm that is used in breast cancer diagnosis, for example. It actually analyzes mammography tests, and then it can lower the false negative results, so the cases where patients suffer from breast cancer, but it is such an early stage that a human doctor cannot see it on the radiological image.
You
so
want to
AI,
say that algorithm is better than a human doctor?
It actually may be better in some cases than a human doctor because, for example, when it comes to medical imaging, AI algorithm knows better what is the difference between very, very, very small changes, for example, oncological changes in the medical image compared to the healthy patient.
Surgical robots, controlled by intelligent systems, are performing increasingly complex operations with extraordinary precision. Medicine is changing fast, thanks to all these new ideas. So what areas of medicine do you think will see the biggest changes?
If we are talking about drug development, like we develop totally new drug on the diseases that we don't have drug, for example. We may have like couple of thousand or tens of thousands potential drugs that can help potentially on this disease. And AI can help us lower this number to, for example, 100 potential drugs. So it can actually check what kind of drug has the biggest potential to have a positive impact on sick patient. And it is actually used in this scenario in probably almost every pharmacological company.
Already now.
Already now.
What will be the future of telemedicine?
In the future, telemedicine will be probably the first step when it comes to contact between patients and doctors, or maybe patients and AI that will help, for example, do basic triage of this patient. So tell if this patient should see doctor right now because there is something going wrong, or that they may, for example, go to the doctor in 1 week, 1 month, 1 year.
Artificial intelligence has the potential to revolutionize medicine. However, while AI offers great promise for medicine, it's important to be aware of the potential pitfalls. AI algorithms can make mistakes, which may lead to incorrect diagnoses and adverse side effects. Additionally, becoming too dependent on AI could be risky.
Most of the time I'm feeling sick. I think I may have a cold, then I Google symptoms and it appears that I probably have a cancer, throat cancer, pancreatic cancer, it depends. How can we rule out those conditions?
Lena, it's really common for our minds to jump to the worst-case scenarios, especially with so much information online. A key step is to avoid self-diagnosing through the internet, as it often leads to unnecessary anxiety. Consulting with a healthcare professional is the best way to get accurate information and peace of mind. They can perform tests to rule out serious conditions and provide reassurance.
Who is responsible for incorrect diagnosis made by AI?
It depends. Of course, AI in medicine is used in the supportive way. So AI is supporting medical doctors, for example, to make a final decision and final diagnosis. So if medical doctor make a final diagnosis, he is responsible or she is responsible for this diagnosis. We also have AI algorithms that are directed for patients. For example, there is an AI algorithm on market that you can make a photo with your smartphone or of your skin and then send this photo to AI algorithm to tell you if you have some skin problem or you have
cancer.
Skin cancer.
Yeah.
Yes. So this kind of algorithm is directed for patients to use, not for medical doctors to use. So if there is some kind of problem with this AI algorithm and it doesn't show good answers that it should provide, because we always have to remember that we have to check sensitivity and specificity for very specific diagnosis that we provide with this algorithm. But if it provides a wrong answer that is not in line with the certification of this AI algorithm, of course, the responsibility lies on the producer of this AI algorithm.
In AI, we don't have rules of responsibility and we don't know the process of making decision about the patient. We don't know which is safe or ethically.
Trust seems to be crucial something in medicine or in healthcare. How can we build trust between patients and AI systems?
Oh, I don't know if we have to build trust between patients and AI systems, because I cannot imagine the situation that patient will be treated only by AI. It will always be a doctor, a nurse, a medical professional that actually uses AI, among other things, and diagnose and treat patients. So we have to be sure that patient understand that medical doctor and nurse and other medical professional will use every newest technology that is actually proven to be sufficient, effective, and safe for patient. And if patient knows that if AI algorithm is used by the doctor because this AI algorithm is safe and effective, there will be trust.
I think AI is an amazing tool. It's a great tool that provides amazing opportunities for both patients and doctors. But of course, this is a tool, so we need to be cautious and treat it as something that may help doctors, but hopefully it will not replace doctors doing their own job.
Should I be scared that robots will take my job in the future?
When you say that in some cases algorithm can be better than a doctor, I have to ask, probably you know what I will ask, whether algorithms will replace doctors.
Of course not. AI algorithms will replace some parts of human doctors' work. So this is the same case as we had with, for example, ultrasonography or stethoscope or computer tomography. It's the newest technology that helps us diagnose patients better, but it doesn't mean that it will replace doctors. But of course, medical doctors have to know how to use AI algorithms so they can actually cooperate with AI algorithms to diagnose and treat better.
I am a young doctor, and soon I will choose a specialty to work for the rest of my life in. So I have a question to you. There are some specialties that may be replaced by AI in the future. What do you think about it? Can you give me some advice?
Thanks, Adriana. It's great that you're considering how AI might impact your career path. While AI can aid in diagnostics and treatment planning, it's less likely to fully replace specialties that require complex decision-making, hands-on procedures, or a high degree of patient interaction, like surgery or psychiatry. Consider focusing on areas where the human touch and nuanced judgment are crucial. Does that help?
Yes, thank you.
The medical field is very particular because you are dealing with very sensitive issues here, where you're dealing with someone's life, with someone's health, and therefore the responsibility is also very big. And quite often now we discuss that there are certain professions with very high responsibility where you cannot delegate too much to AI. You can use AI as a tool, but we don't see a pathway forward with replacing a medical professional like a radiologist with an AI system. The AI system can do some pre-screening, can support the doctor, but the doctor needs to validate the result by themselves. So I know that there were fears surrounding AI and radiology among the radiologists, but I think these fears are now unsupported in the sense that more of the medical professionals see how they can collaborate with this technology and not be replaced by it.
If you can't diagnose me or help with therapy, how can you help me?
Lena, I can help by providing information, resources, and support to help you better understand your concerns. I can also offer tips on managing anxiety, suggest questions to ask your healthcare provider, and help you navigate health information. Think of me as a helpful guide to support you along the way.
With medicine, the results of the treatment we may introduce to patient is really important, how he sees us as a competent partner to this relationship. So the compliance, which means that patient is willing to listen to us and wants to be healthy because he trusts our vision and decision we are making. This is something that, in my opinion, is so valuable and it's impossible to replace by a robot.
There is a wide agreement among the healthcare professionals that you cannot over-rely on artificial intelligence. We have heard about cases where an AI system was doing very good predictive modeling of a given health problem, and therefore some experts would really rely on it fully. However, after a couple of years of such exercise, I think the majority of healthcare professionals would tell you that these systems cannot be delegated tasks to at all, and it's also illegal to do that. So in that way, I think we see limitations of this technology, but we also recognize that there is no problem of over-reliance on it because it's just illegal to do so.
You can be a good doctor without knowledge about AI nowadays?
I don't think so. I don't think so. This is like, if you are a medical doctor, you accept the fact that you have to learn your whole life, and there will be new technology after new technology during our lifetime. And you have to know what is going on, and you have to know what is on the market to help you diagnose and treat better. So AI is this kind of technology that not every AI algorithm, but some of AI algorithms can help you to help other patients, and you should know it, and you should know how to use it effectively.
I'm totally open for sure for this cooperation, because I believe that we should really use the technology advantages it presents, but also there are some concerns that many doctors have, and also we need to remember about it. So everything is a tool. If it's used with caution, it's a perfect way to help patients.
Thank you for your time. It was a pleasure speaking with you. Goodbye for now. I appreciate your perspective. See you next time until our paths cross again in the digital realm.